Hello everyone, I'm Dr. Salman, consultant plastic surgeon. Today we'll talk about hair loss, but in women, aged 50 plus. No gimmicks, what really works. A lot of women at this age, they face hair loss, but they don't know the real reason behind it. Some associate it with aging, some associated with hormonal changes that come with this age, some associated with the shampoo that they have been using recently, some associated with hair dye. What is it that actually leads to hair loss at this age? We need to understand the cause. It's not just the age, it's a combination. It is the age, the impending menopause leading to hormonal changes that occur at that age. It is also the nutrient deficiencies that come up, long-standing blood loss, long-standing iron deficiency, vitamin D deficiency, zinc deficiency. All these things together with the general poor health, sometimes diseases, long-standing diseases, metabolic disorders like diabetes and hypertension, some even cardiac diseases. All these things together, they can contribute to hair loss at the age of 50 and above. Now, we talk about the science, what doesn't work, and then what will work. What won't work are the different types of wigs, the camouflage, the different types of shampoos in the market for anti-hair fall, onion therapy, onion water, aloe vera, and different things. Anyone who thinks about anything from a topical shampoo to a derma roller, you need to understand these things are not actually effective. What truly works, we'll talk about that now. First of all, you need to have a proper history. When did the hair fall start? How was the family history? Is it the female pattern hair loss or female pattern baldness, or is it just hair fall? How's the hormonal profile? How's the general health of the patient? If needed, we go for the blood tests, vitamin D, hemoglobin, iron levels, serum ferritin. All of these contribute to hair loss. What truly works then is the PRP. If the hemoglobin and iron ferritin levels are good, PRP or PRGF is a very effective treatment. Low laser light therapy, LLT, that is also very effective. It's like a cap that you can find on Amazon and eBay. And that cap emits laser light. You wear it for 30 to 60 minutes, even when you're working in your kitchen or somewhere. You can wear that cap. That helps. It's especially good for people who cannot come for PRP multiple sessions. Supplementation of iron, folic acid, correction of any hormonal levels, vitamin D, thyroid function, all of these, when they are normalized, that would control your hair fall. Prescription medicines like supplements or hormonal replacement therapies, they are helpful. That would only be done by your doctor. Non-prescription medications, the only thing that really works is actually minoxidil. Minoxidil increases the blood supply to the scalp, and that helps to transform the thin terminal vellus hair into thicker hair that can cover up the space. Apart from that, PRP, PRGF, with a lot of growth factors from your own blood, that is effective. The latest treatment, exosomes, very effective. It converts the vellus, the terminal hair, into the thick, healthy, younger hair that are able to grow in length and also to give you the coverage. Hair transplant, it works for people who have frontal hairline thinning, and we can take grafts from the back and put them here so they grow and cover up the area. I'm not a fan of microneedling devices because I believe microneedling done at home is completely useless. It's effective only when you injure the skin enough that it leads to what we call punctate bleeding. But when you're doing it yourself, it's very hard. Mostly people cannot take that pain. Secondly, the roller actually, the thin, fine hair, they'll stick into the roller and you lose them anyway because of the mechanical trauma. So I recommend PRP or PRGF with microneedling and a clinic setup with a local anesthesia all around so you can appropriately inject and do thorough microneedling. Exosomes, the latest, is it's very good treatment, and hair transplant, it's rare but can be done. So in summary, I would say whenever, if you're more than 50 and you have hair fall, see, consult my team, get an appointment so I can assess what is the cause behind it, and then we treat the cause accordingly. And always remember one thing: the best treatment is not to grow the hair. You need to have realistic expectations. Even if you're able to control the hair loss, that is a major, major step in female pattern hair loss. And if we can get that, it is enough to supplement that with supplementations, PRPs, and to give life to the existing hair. So even if you can control the hair fall, that is also a big, big achievement in female pattern hair loss. If you have any questions, drop them in comments, get in touch with my team. Stay young, stay healthy, and take good care of yourself.